Ms. Shonaway. Oh, shoot. Okay. Good morning. I ask you to be patient with me in dealing with a person that's dealing with cataracts, so I might be a little slow in this. But welcome to the February 13th board workshop meeting of the Escambia County School Directors of Children Trust. This meeting is called to order by myself at this time of 9:04 a.m. Please turn off all of your cell phone devices and put them on mute during the duration of the meeting. If any visitors plan to make comments or speak to the agenda, please fill out a public comment form, and that's located, I believe, at the front, and turn it in to Ms. Ellis. Roll call by Ms. Alma Ellis, thank you.
Thank you. Tory Woods. Mr. Williams.
Here.
Mr. Peden.
Here.
Dr. Northup.
Here.
Mr. Leonard.
Here.
Ms. Kane. Commissioner May. Stephanie White.
Here.
Judge Harris. Thank you.
Would everyone please stand for the pledge? Join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item on the agenda is the approval of the agenda. Thank you to the commission. Is there any motion to approve the agenda?
So moved. Second.
Agenda is moved in second. Let's vote. All in favor signify by the normal sign.
Aye.
Aye. Next on the agenda is approval of the minutes. Can I get a recommendation to approve the minutes?
So moved.
Second.
And does everyone vote by signifying by the usual sign?
Aye.
So move. Agenda is approved. Moving to the Treasury report by Mr. Peden.
Thank you, Mr. Chair. You'll find your financial statement inside the packet, very detailed report of what the trust financial situation is at this point. There were no unusual or abnormal transactions conducted during the month. If there's any questions about anything in the financial statement, we'll be happy to entertain any questions. Hearing none, without objection, the financial statement will be filed for audit. Thank you, Mr. Chair.
Thank you. And we don't need to approve that. Do we need to approve? Okay. At this time, we will open the floor for the public comments. Are there any public comments?
We have none.
We have none. We'll move on to the next section of the business. As we move on to the business portion of the meeting, I understand we have a few guests today. Ms. Abram, will you do the honor of introducing our guests?
Thank you, Mr. Williams. I'll step in on this one. We have two presenters before us today representing programs that we contract with, and we're excited to bring them before the board today to provide us with an update First, we'd like to welcome Leslie Powell Boudreau, the longtime Executive Director of Legal Services of North Florida, to talk to us about the program that you all approved last spring, a 3-year contract to achieve 2 goals and 4 objectives. This is a program that is really transformative for our peer in Palm Beach. This is an evidence-based practice listed and evaluated by the Centers for Disease Control that we're bringing here to Escambia County children. And you might remember that there were 2 goals that Legal Services proposed and that we contracted with them to achieve. One was improving access to legal resources for Escambia children in dependency, and the second was improving access to educational advocacy resources for children with disabilities. They've made tremendous progress. It's been 9 months since the contract was executed, so we thought it was a great time to bring Leslie and her team before you. Thank you, Leslie.
Thank you so much. Again, my name is Leslie Powell Boudreau. I'm the Executive Director of Legal Services North Florida. Thank you for giving us a little time to share the work that we're doing with you. As staff has shared, we've been working on this for 9 months. As any project, we've spent some time in those initial months making sure we were reaching out to the right people, letting people know about what we're doing. You're going to hear a lot more about those details from members of our team. So we've split this up into 3 of us who are just going to share some information. But that, as mentioned, that goal with the Palm Beach project and to replicate that in a way that was meaningful and to borrow from those evidence-based practices that have really been successful for them for years was the core of this program. And making sure that when we looked at youth in dependency, we were keeping an additional eye on the needs of those youth and the services that could be provided to bring them to permanency faster and in a more stable way. We also wanted to focus on crossover youth, meaning youth who are in delinquency and dependency, so that they often have special needs that aren't being met because of both their age and the challenges of working within those 2 systems. So trying to make sure that we are providing those additional services, supporting the public defender in the work that they're doing, making sure that there's an understanding of what's happening in the dependency along with the delinquency to achieve the best results for those youth as well. And then again, the educational advocacy for children with special needs and disabilities. So we've built this, we've learned a great deal, and we want to share some of those lessons with you. But since building the project and developing the relationships, our team has spent more than 150 hours in court, almost 50 hours doing home visits with the children, which those home visits are so critical to make sure not only that we're seeing the children and making sure we know what their needs are, but actually getting a sense of the space they're living in, what issues there might be with that space. And in addition, with the educational piece in particular, our staff has spent more than 200 hours in the community, educating the community about what educational rights means, what resolutions there might be in terms of individual education plans and other issues. And there have been a few surprises throughout that whole process. You're going to hear a little bit about truancy court and some other things that I don't know that we anticipated how great the needs would be. So with that, I will go ahead and pass it off to Nicole Goheen, who's one of our attorneys who's working primarily in the dependency, and she's going to talk a little bit about the work that she's doing there.
Good morning, board. So I do want to share on the dependency side, the goal of dependency is to get children in their permanent placement as quickly and safely as possible. And we want to focus on reunification with their families. So how are we doing that? Number one, we're ensuring that the children's needs are being met while they're in the system. Their mental health needs, their educational needs, medical needs. So what we've been able to do is get needed documents for the children. We get birth certificates to make sure that they can get on Medicaid. We've gotten birth certificates and IDs to make sure they can get in school enrollment. So we have helped with school enrollment. We had one child who was not in school for 4 years, and we were able to get his documents, get him enrolled. We even took him to take his GED placement test. Again, with the home visits, making sure the children are safe in the home, making sure the caregivers have what they need in order to take care of the children in the home. We've been providing services, again, such as mental health, tutoring, psychiatric evaluations. We monitor how the children are doing in that placement. We do have a very medically complex child whose life is just full of different doctor's appointments. So we just monitor those, make sure they're meeting those goals. We're available in case a court order is needed. So a lot of times with anesthesia or surgeries, court orders are needed. We want to make sure that we're there and available to make sure there's no gap in those services. With parents, we want to make sure that parents know what their expectations are in the system. So we go over case plans with them. We make sure they understand what's expected, make sure they have their information that they need for their service providers. We've helped facilitate services for parents. We had one parent that was relocating to a different state, and we were able to contact that state, go through the case plan, get their matched up services, so there was no gap in services for that parent, and we were meeting reasonable efforts for that family. And overall in the dependency system, we just want to help coordinate information among the parties and the court system. That's how the court makes the best decisions for these families and these children, is to have as much information as possible, to make those decisions. On the truancy side of things, again, we've been able to bridge that gap of communication between the families and the school system. We were able to obtain a computer for a child that was facing bullying in school due to a medical issue he had. So we were able to get that computer. We helped enroll him in virtual school, and we're able to monitor his progress in the school system. Also, we give those children services, again, with the tutoring. We get kids started with counseling. We partner with another ECT program, Escambia Connects, to serve those children in the court system. So our goals moving forward is just to be involved with as many families as we can, to make sure their needs are being met, to bridge that communication gap, make sure referrals are being made timely for the parents, for the children. A lot of times this miscommunication, lack of communication, last-minute communication is really a barrier to these cases moving forward. And we wanted to go in there and kind of bridge those gaps and see where is this miscommunication coming from. Let's work on that. And again, that way, the court and everyone is making the best decisions for these children. So that's just some of the things that we're doing on those sides. We also have our juvenile cases, which another attorney, Rebecca Cherninsky, is going to present on. So thank you.
Good morning. I am new to legal services. I have been there about 2 months, but I am old to the delinquency system. I've worked in the delinquency system for 26 years now. So that is kind of part of my focus, as well as the educational rights. As far as kind of tapping into the delinquency system, we have many youth in Escambia County on probation, coming out of residential programs, and they just they're not getting the services that they need. One good thing about working in that system, while we work with the public defender's office as the case is going through the court, once that child is, dispoed, the public defender is done. And then at that point, there are no really other players involved, but we are able to continue on with the youth and making sure that, if they need to get enrolled in school, that is something, that we can assist with. If we need to initiate any kind of special education services, that is something that we're focusing on, coordinating with other agencies, the Department of Juvenile Justice, other programs in the community, Escambia Connects, working with probation officers to try to actually proactively solve some of these issues so that they don't come to court in the first place. We've had several probation officers reach out to us recently saying, look, I've got kids on my caseload, they have IEPs, they're getting all these referrals at school, school's trying to kick them out, don't they need to check their IEP first? Can you talk to the family? Because otherwise, their only alternative is to violate that child, and then they're back in court. So we are able to kind of reach out to the families prior to that to hopefully fix some of these issues. Another big part that we focus on are administrative educational hearings. Actually, my second day at Legal Services, I didn't even have a computer yet, but we got a case of a child who was facing expulsion until 2025. She was in 7th grade, and they were trying to expel her till 2025. This was the first referral she had ever gotten in her educational career. And it was for an incident that happened on the bus. And we were able to go with her to the hearing. She ended up getting 2 weeks of in-school suspension and then was able to return to class. So those are the kind of things that are happening out here in Escambia County that we're just trying to assist with. A great part of what I've done since I've been here is working on the community education piece. We have done many events. We have attended parent university events at local schools. We have done the YMCA back to school events. We've done some parent presentations at Westgate High School, Justice on the Block for some of the homeless youth in the community. We've presented, as I said, in front of the Department of Juvenile Justice to make sure they're aware of what we have to offer. We've been working closely with Escambia Connects, which provides informal mental health services, and we've kind of been referring kids back and forth because a lot of these kids, they have multiple issues. They have education issues, they have mental health issues, so we've been working with them. I'm very excited. We've got 2 new partnerships that we've been working on that I'm very excited about. We were contacted by Rodney Jones with New World Believers in the Hoops program. So we have been meeting with him. We're going to be providing, monthly parent presentations, youth presentations. Again, just making sure that they're all aware of what rights they have, what services are available. And then again, also just trying to help the youth succeed. And then we have a new case manager that we are just hiring, and she has really reached out to Children's Home Society to try to get with the school navigators. So we will be meeting with all 30 plus of the school navigators. Again, we're trying to be very proactive. We don't want to wait till we get to dependency court, wait till we get to delinquency court, and then try to fix it and be in other people's way. We're trying to be proactive and avoid these children getting to that point. So that is what we are excited about moving forward. If the board has any questions, I think Leslie is here to field those.
Yeah, and just to echo what Rebecca said, we're really looking at root causes. What are the root causes that bring people into dependency, into delinquency, and cause those educational disconnects with the education system? Those are often complex issues, and just to have another voice in the room that's representing the child and representing the family is so helpful in resolving those problems. So again, if there's any questions that y'all have, we'd be glad to answer them.
I had one question. You said that you represent students when they been removed. Mm-hmm. You go into the hearing and the due process part of the
Correct.
procedure.
Yeah, the administrative hearings through due process, we work through those. Sometimes those issues can be resolved before a due process hearing, but if it does reach the due process hearing, we do handle those. And again, those are legal proceedings, and a lot of times parents don't know what their rights are in that process. So being able to walk them through the process, make sure they understand, and even do fact-finding ahead of time to make sure that we have a really good sense of what expectations we can have. Like, if there really was an issue with the child, let's talk about expectations. Let's talk about alternative services to things like expulsion and suspension. So, but yes, the legal proceeding is those due process hearings.
And one other question, you might have mentioned it, but these services are free?
Correct.
A question in regards to the individual you mentioned had been out of school for 4 years. and it was very pleased to hear you all said you had assisted with getting the individual's GED, getting that accomplished. I was curious as to the reason that we have an individual who was out of school for 4 years, and if there was an opportunity there on the larger scale rather than just the one individual for your involvement.
Yes, so with that particular child, unfortunately, he had been in and out of the dependency system for years and in different states. So just, you know, that upheaval in his life, being in different states, constantly bouncing back and forth, going back to the family that then wouldn't enroll him in school. So that was his background. So now that he's here, he is with a relative, we were able to assist with getting him in school.
Very good. Thank you. I have another question in the larger scheme of things, as much for the providers as it is for the Children's Trust. And we have as another item coming up the contract renewal with Children's Home Society, and noting the part there of linking these things. I'm delighted to hear you all collaborating with other entities within the Escambia County and things, and I think that's a wonderful part of what the trust will help do, is facilitate those relationships. But the linkage, I noticed in the contract with the Children's Home Society, there's a requirement in there for the provider, if possible, and they've got the technology to link on theirs with the Children's Home or with the Children's Trust, and wondering, as part of this, trying to facilitate communication and things, of having people aware simply that these services exist. Yours, Children's Home Society, all of the providers that we're doing, and trying to make people aware of these. I noticed in looking at your presentation, you all can apply on the website. You can apply by calling the office in person, that type of thing. But wondering about linkages, hopefully the Children's Trust, I see WEAR here and things, people become more and more aware of the Children's Trust, of us looking at the opportunity on our website to provide linkages to these providers, so that if people become whoever, I want to, and I think we all do, I don't want to be speaking unilaterally here, all want to be facilitating the community's awareness that these services are there, how to access these services, and as the Children's Trust becomes more increased awareness, that people would be able to go to the trust site and then find linkages to these other services such as yours and the other providers. I'm just throwing that out there as ways for people to become aware of this, and then how do they access it?
I mean, one thing that, as you're talking, that I'm thinking of, I know that we have ECT on our website as a logo, but I don't think we have it as a hyperlink, and that's something that we could do that would certainly help promote that linkage as well. So we'll look into doing that.
I just want to say thank you, because as you know, I'm a big advocate of attorneys for children in Independency Court, and I do some of that pro bono. So it's really helpful to have attorneys who this is their full-time job doing that. So thank you for all you're doing for these kiddos.
Same, thank you.
Thank you.
Just one question Mr. Williams asked, one that I would have asked as well. As it relates, so my question is a different one. As it relates to truancy court, I have the misfortune of having to sign literally hundreds of truancy cases. Are you seeing any success in getting those, whether it's working through Judge Williams, to be able to get those kids back in school with good attendance? I know I heard the one or the second, two events, but I mean, it's literally hundreds. And when we have to send officers to those houses, many times we can't find the guardian or the parent. What type of success are you having? Because we need them in school, and really they need to be in school, because it's against the law to not be in school.
Yes, so it is difficult because, you know, part of the reason that a lot of these children are in truancy is the parents and their lack of parenting. So it's difficult for us to come in, you know, and say, okay, start parenting the child. You know, this is what you do. With our individual that we've helped kind of the most. We've gotten him in virtual school. It is a slow process. We have families who, don't understand the system. They don't understand, computer setups and things like that. So we're kind of starting at the very beginning to say, okay, this is how, to get your child in there. So that's been a lot of it. Is we do have parents that want to try. They just don't know how. And we're in the better position to kind of show them what's going on, bridge those gaps between the school communication. Sometimes schools will call, leave one message, and then that's, what we see. So we're having some success. We are just getting appointed to a couple of them, so, we're not sure about kind of quite the numbers yet. But what we're hoping for is at least giving those parents and those students the services and setting them up for success. Now, whether, they can achieve that, sometimes that's out of our hands. But if we're not even starting with, let's show you what to do and what the, process is and trying to help you, they're never going to even have that opportunity to achieve success. So that's at least what we're trying to do, is say, let's set you up for success. So it is hard to tell right now. I know, again, the parents are difficult in those situations, but so long as they're having someone that's trying to show them the tools, that at least gives them, one leg up than where they were at.
I just wanted to add to that. I think one thing that I've really noticed in truancy court that I personally think we should be appointed to every kid in truancy court, honestly, because I think going in, it's adversarial. I mean, to the parents, it isn't, but to the parents, they're being brought into court because they feel like the school's trying to put them in jail and that the judge is trying to put them in jail for failing their child. And the school is frustrated with parents who don't always communicate properly or, follow up. So I think we've really been able to kind of step in as a mediator, and speak to both sides and just say to the school, look, we're trying to help you, school district. The parents really do want to do the right thing. They just don't always know how. And to the parents, the school's they don't want you in jail. They really just want your child in school. They're trying to help you. And so I really think we've been able to kind of foster a better relationship between those two groups and, kind of open the communication between them to be able to allow them to get what they both want, which is the child in school. So I'm super excited about, our prospects with the truancy court. Like I said, we have just been appointed so far on a few, and there are definitely kinks that we are working out, with Florida Virtual School. A lot of these children, like our child we were talking about, he has a medical condition. He has dealt with extreme bullying. He is currently in counseling trying to gain some self-confidence, but he just does not want to go to school. So rather than him just not go to school, we're trying this Florida Virtual option. But when a child enrolls in Florida Virtual School, they're basically on their own. There is no coordinator within the school district that works with them. They are just told to figure it out. And it is extremely intense and technological. I've had to Google, how to do this to
I want to make certain that I
teach them.
let you know that there is not just one, but several people in charge of Escambia Virtual School. So if you're not getting responses from Escambia Virtual School, please let me know. I can't speak on behalf of Florida Virtual School.
Right.
So I want to make sure that our public knows that there are several
Yes.
people that will assist
There are.
with Escambia Virtual School.
Yes.
Okay.
Now, I will say that our youth were not accepted into Escambia Virtual School. So that is, it's a difficult program. That is a wonderful program. I wish they could all be in that. But when they're not in that, they have nothing. So I feel like we have been successful in that and want to continue on.
And one last question, and especially when you get to the request for formal hearing for some of these students that are possibly being removed. My concern is always safety with our Escambia County school system, and sometimes we have some serious infractions that student probably needs to be removed, such as weapons and drugs. I mean, do you would still work with them on those type of cases?
Absolutely, and I think as Leslie said, part of that is managing expectations. So for a student like that, absolutely, they may need to be removed. But even beyond that, once they are removed, they still need to be educated. So yes, I mean, and that's one thing I really believe that we are kind of a comprehensive guide to helping these families. We're not just lawyers trying to go into court and file things and be difficult. We really are, it's kind of a holistic approach to doing what's in the child's best interest, and in Escambia County's best interest, and in the school's best interest. So just kind of trying to work with all of that. But yes,
Well, I appreciate that. It's very
Yeah, that
admirable
child,
what you're trying to do.
once he is removed, again, he's gonna need to go somewhere, so we'll figure
Yes,
that part
yeah.
out.
We're still required to educate them regardless if it's in our school system or not.
And one small piece that I'd like to add is that it's not always just about whether or not the schools and the parents are communicating. Sometimes there are real issues in the home. Perhaps there are conditions issues in the home. The parent's working multiple jobs, so isn't really paying attention to whether or not the child's getting to school, so the additional services may facilitate that. Really, it does go back to that root cause analysis of how did we get here and how can we solve those problems. Sometimes it's a legal solution, sometimes it will be through our partners, and that's where that networking and collaboration comes through, and we're hoping to continue to build on that and make sure we're making full use of all the services in the community, including those that are funded through the ECT. Thank you.
And thank you again. I said it's very admirable what you're doing. Thank you.
Thank you so much. Mr. Williams, we have our second speaker, if the board is ready. Mr. Hassan Hills with Youth Left Behind has a special presentation. Ms. Powell-Boudreau mentioned two of our funded programs that are also part of the funding stream that Mr. Hills was approved, our mental health RFP, which kicked off on March 1st with the services he's going to describe to you. And thank you for working with Escambia Connects and Hoops, which are two of the other funded programs as part of that mental health RFP.
Good morning. How y'all doing this morning? First and foremost, I want to thank the staff with the trust for allowing me the opportunity to bring forth services to the children of Escambia County, especially in the 32501 and 325 district, where it's very well needed. We went into contract October the 1st, had a few barriers dealing with startup funding because this program is done on the reimbursement. The Escambia County Sheriff Department led funding came in and gave us some funding to purchase some stuff that we needed in order to go ahead and get started. And I went through several trainings. I called Ms. Abrams, I sent emails out, I called Mr. Moore. I was like, hey, I want to make sure that I'm doing what's expected of me when we're working with taxpayers' money. I want to make sure that it's effective. I want to make sure that I'm meeting the need of the people. And I also want to make sure that I'm being held accountable for what I'm doing. I want to do everything right. And I went through about 4 trainings. So we got started November the 7th. November the 7th, we started our first peer group empowerment with Youth Left Behind. And I must say, it's been an honor working with these young men. Every last one of the young men in our program has increased their grade point average to a 2.0 or higher, with the highest young man with a 3.14. Return to public schools. We have 2 of our young men that was in alternative schools, and due to the program and their attitude at home and things like that, they're now back in public school. Completing community service. We believe in providing a more excellent way in changing the narrative of what's expected of the black men in the low-income community. So we take them out to community engagements. They do community service. They bring 2 canned goods, if they can, to the program, and we take those canned goods and we give them out throughout the community where it's most needed at. In the past 90 days, we have 25 participants. We started off with 7. We got 0 referrals with the Escambia County School District. Not 1 referral. And I'm not talking about young men that's doing so great and they got a high GPA, and I'm talking about young men that's struggling. that's really struggling, that just needed somebody outside the home that would just sit down and just listen and find that need assessment, find that direct client assistant that's needed for their particular situation. Increase home relationships. I have sent out surveys to all the parents that I've presented inside my review coming up. And the parents are like, hey, his attitude, I don't have to tell him to do his homework, Mr. Hills. I don't have to tell him to take out the trash. He's going to school on time. He's getting along with his brother and his sister. And that in itself let us know that the program is working and it's going to do great things here in Escambia County. We created job opportunities. We have a continuing care coordinator that came on board as a volunteer. And what she does is the youths that complete 3 classes, she sit down with them and we find out what's the best thing for them as far as job opportunity if they can work. We partnership with Hungry Howie's. We partnership with High Point. We partnership with the Print Center on Pace Boulevard. And we're able to provide job opportunities for our young men at a decent wage. Each one of the employers have agreed that if they're enrolled in our program, they want to help them reach new horizons. The pay is no less than $15 an hour. Grades have tremendously increased in one semester. Current maintains a 2.18 great GPA. Communication skills have increased with parents and guardians and teachers. Overall mental health, quality of life. This is J. Michael Jetter. I have his mom here with me, his grandmother, if she want to come up. This is one of the young men that enrolled into my program that wasn't doing so great. And when I called his mom and told her that I was coming down to present a slide, I wanted her just to let the trust know the work that we're doing and how it's affecting her family as a whole in ways that we can do something better. How can we make it better, or are we doing a great job? And just give a little bit of feedback, if you would.
Good morning. Very nice to be here and represent Hassan and all the wonderful things that he's done for me, myself, my family, for my son. Well, actually my grandson, but I legally adopted him. We lived in Mobile. We moved to Pensacola 5 years ago to try to get more help for my grandson. He has some behavioral issues he's being diagnosed with. He was not doing good in school, and in Mobile, they had him in front of a computer working by himself because they didn't know how to handle him. When he came here, he's had a lot of adjustments. He's had a lot of back and forth. He was in a program before he got in trouble. He got into some trouble, and when he came out of his troubles that he was in, they dumped him. They were having trouble with the program. It was through one of the programs through Lakeview. And constantly it was different people that were coming to the house trying to help him. It wasn't anybody like Hassan was there 24/7. I think that's made a great difference. I don't think I know. If you looked at his report cards when we came here, he has gone from referrals every week, failing grades every week. He has he's missed 1 day of school this year for a death in the family. He has had A's and B's. He's no referrals. And I mean, this is a child that went through multiple difficulties, and he started high school this year. Can you imagine that he was in all this trouble? And it's a big step to go from middle school to high school. And with Hassan's help, he has, like I say, no referrals. I've had nothing but good responses from the teachers. I went to his IEP the other day, and they were like, this is unreal, you know. He's excelling at school. At home, there's still some difficulties. That's where Hassan, you know, steps in and says, look, you know, I'll talk to him, talk to you, work things out. And I've been really, really helpful. It's been really, really helpful. Hey, everything that I've reached out to, so like I'm going to tell y'all, I contacted about 6 different places to get help for Jermichael when he got out of trouble. And I started on my list. I had a list. Started on my list, and I got about halfway down. I said, well, no help here, no help, no help. I started on the bottom. You know who was on the bottom of the list? Hassan. And I called him. He said, I'm right on top now. We gon' this is going to be a good program. He's had different sessions, and Michael's gone with every session. I think he's missed like one meeting, like I say, when we had to cut a death in our family. But thank you for any help that y'all can give us, or you can give the program that he's really been phenomenal.
Thank you. As Ms. Jeter has just stated, as me having the live life experience, I can connect with the children in a different way. And that connection is sometimes just sitting down, having a power session of a 30-minute conversation and just listening. See, sometimes I would do a home visit and I would just listen. And I'm taking in everything that these young men tell me that they're going through, and it better helps me provide the resources or the direct client assistance or the programs to be able to help them and put them on the path to success. Each child, we deal with a lot of gun violence in our community. So part of our program design is gun violence awareness, not just mental health, because if you look at trauma, gun violence awareness, mental health, all that plays a part in the mental health of a young person. So we had a gun violence awareness session to where each one of the youths took a pledge not to use a gun, pick up a gun in anger, hang around people that play with guns, or discuss guns and its effect in our, and we discuss guns and its effect in our community. And I asked the youth a question: how do you feel about gun violence? And I want you to be real with me. And they told me they don't like it. Some of them are scared to go to certain places. Some of them are scared to go to school because of the gun violence that we face, not just in our county, but just as a whole. So what we try to do is we're trying to change the narrative. If we can build the quality of life in 25 or 30 youths at a time and expand, then that can reach out to other people. And they can start bringing their friends into the program. And we'll be having a wildly different conversation a year now about young men in our community I view as assets if given the proper services. Mental health circle. We have a mental health circle. Inside our mental health circle, before every class, we do a breathing exercise. Everybody get to sit down. There's no talking, no cell phones. And we just sit there and just breathe. Breathe in, breathe out. And I think that that's a positive motivational affirmation among peers, is learning to cope with different mechanisms to deal with stressors of the world. We could only imagine some of the things that some of these children face when they're not in our care. Whether it be bullying in school, whether it be the lack of parenting, whether it be an incarcerated parent, or whether it just be lack of resources, they go through a lot. And I believe that with that circle amongst their peers, the difference in this group is you get better feedback when you have young men in the group and they can receive positive self-talk from somebody who looks like them, somebody the same age as them, somebody that's experiencing some of the things that they're experiencing, and that's where you get your best work done at. Community partnerships. During our program, we reached out to Sunshine Health, as well as our armed services, and transitioned through Triumph, a domestic violence survivor and awareness. And we had a family and friends day. Not only do we want to serve the children, but you cannot serve a child and then let the family or the mother or the father be in the same condition. So I asked the kids how would they feel about inviting their parents into one of our classes. And they was like, yeah, I want my mom to come, I want my brother to come. So what we did is, in December, we hosted two days. And during those days, we had Sunshine Health come out, and they was able to provide wellness and information about insurance and stuff like that. We had a member from our armed services come out and talk to our teens that's 15, 16 years old that might want to go into the armed services. And I think that that was a great time for families to connect. That was a great time for children to be able to sit down with their family, express themselves, and just be aware of the resources that's here for them. Our staff consists of about 8 people. We have about 12 volunteers. It hasn't been easy, I must say that. As the director of a new organization, as she stated, my name was at the bottom of the list. I'm not worried about being at the bottom of the list. I just want to be effective. I want to meet the need of the children. And our staff just completed their CPR first aid certification. 80% of our staff are certified in CPR. At our group sessions, there's 2 people on staff at all times that's CPR first aid certified. We was also certified and not certified, but trained on how to use Narcan. We work in the community to where any given time we might come in contact with somebody that's been overdosed. And I wanted the staff to be able to know what to do in those situations. Properly trained in first aid and CPR, as I stated. And last but not least, you want to make sure that people working around your children are able to work around your kids. So we we have level 2 background checks, Diana sex screen checks. I've contacted the Florida Department of Law Enforcement. I did all the paperwork, and in the next 14 days, 7 to 14 days, all my staff and volunteer will have a background check, level 2, with Diana sex screen check, because you never want to expose a person's child to something that they're not supposed to be exposed to. So those are the measures that we're taking to ensure the safety of the children that we serve. We've also just installed a camera system inside our van. We have a van, a 7-passenger van, as I stated before. And I just want to expound on the van. Right now, we service 25 kids. Out of those 25 children, 15 of them need transportation. So I want to give the board an outlook of what a Tuesday look like in that van. We have to go all the way to the north end of Escambia County off Lepley Road, and we pick up 2 children. We leave there, we have to drive over here by Workman Middle School. We pick up 3 kids. We leave there, we go downtown on Davila Street. We pick up 1 kid. We have to make a drop off to the building then. We leave from there, we have to go to Addis Court and pick up 3 kids. We leave Addis Court, we have to go to the Pines and pick up 2 kids. We leave the Pines, we have to go to Marino Court, pick up 1 kid. We leave Marino Court, we have to go off Hawthorne Drive and pick up 1 kid. We have to drop off at the building. Once we get done with that, we have to go in the Montclair Mayfair area and pick up 1 child and drop them off. That's one of the barriers that we face right now by the program growing so quickly. We didn't know that the community as a whole would say, hey, I want my kid to be a part of that. So that's one of the barriers that we face, but we're trying to work some things out, not only just through the trust, but we're reaching out trying to obtain additional funding to be able to be sustainable throughout the years to come, because this is a program that I believe in, that I would like to see in every area in Escambia County in the next 5 years, especially in area housing. That's the vision for Youth Left Behind. Part of our program design was that we would go on a field trip 4 times a year. And this year our field trip was to the state capitol and to FAMU. We were able to take our children to FAMU to get a tour. They toured the whole college. And when they found out we was coming, a gentleman by the name of Jalen Glaze from Escambia County that plays football there, he reached out and said, hey, do you mind if I join y'all and talk to the young men? I said, sure. So he was able to walk with us on the tour, and he mentored them, and he talked to them about the things that he faced and the challenges and where he's at now. They were able to go to the cafeteria at the college and eat a college-style meal right there. I just wanted to expose them to a different culture. And we had a great time. We went back to the hotel, where we stayed for a couple days. We went back to the hotel, and once we got there, they was able to go inside the workout room and work out. They was able to go swimming, and they played video games, and we had a great time. That next morning, we all got dressed, and we walked 4 blocks to the Capitol. When we got to the Capitol, we did a tour of the Capitol, and I took them to the rooms, and the Florida Cares was there, and as you can see, Crime Survivors was there. And the reason why I wanted them to attend Crime Survivors is because every last one of the kids that I service has been exposed to some sort of trauma. and that was a day of healing for him. And once we left there, we were able to walk the halls of the Capitol, and we visited our state legislators and representatives and senators. We had a chance to meet our own Michelle Salzman, went there and talked to her. And the boys and the experience that they had was like, hey, my mom and my dad never been to FAMU. And one of the kids, I have it at the office, he took one of the guides, and everybody who he met, he had them sign the autograph. He said, this right here is going to be a memory of a lifetime. And I just believe that when you expose young men to different cultures and spend time with them and provide that more excellent way, that's how you put them on a path to success. So on behalf of the organization, I just want to extend my gratitude for the trust, believing in this small grassroots organization that started from nowhere and wanted to make an impact. I thank you guys for believing in me. There's much more to come. We're outgrowing our building. It was gifted for 3 years, and we're grateful, but we're outgrowing. So in the years and the months to come, we want to expand and do more to better serve the community and give them more dosage. I want to give them more dosage. I want to be able to work with them day in and day out. I want to be able to provide tutoring 2 days out the week for those that may need it. I want to be able to provide that direct client assistance. And you hear me say that a lot because working with these young men, I came to realize that their direct client assistance is totally different from direct client assistance that others may need. Just the basic necessities of just a pair of sheets on their bed, a coat during the winter, a haircut to go to school with, a nice shirt to go to school with. We have our resource table every week, and we provide soap, deodorant, toothpaste, book bags, paper, pencils, pamphlets, preventative measures, because we want to make sure that they're able to get the stuff that they need. And last but not least, every child that come in contact with our program get fed a meal. I don't mean pizza, I don't mean a taco, I mean a meal. And the reason why I do that is because you will never know the conditions of what lies ahead when they leave. And we had one of our students come and say, hey, Mr. Hills. I said, yeah. He said, can I take the rest of that home? I'm like, sure, go ahead. So something in my heart, something said, pull him to the side and figure out why he asked you to take that home. And I asked him, he said, because my sister is 6 and my brother is 9, and they not old enough to come to the program, and we don't have food at the house. So we implemented the measures of you eat as much as you want here, and we got to-go trays. Everybody get to take a to-go tray home. Everybody get to take a to-go tray home, because I want to make sure that the children that we come in contact with are being given the service that this board provides the funding for. And I want to thank y'all for that. Anybody have any questions?
Kudos to you and the service you are providing. This is just amazing, and this is exactly the type of impact that I think I individually, and I think the board just wants to see, and what the community wants to see funded. And bless you, and thank you.
I just want to say thank you as well. I remember one of the first nights you came, way back when, and you have certainly done a fabulous job, and it's so good to see this. And I just want to thank you for your heart and soul that you've put into it. It is making a difference.
Thank you, Mr. Hills. Thank you.
Children. I believe the next, OLIMC, Children Home Society, contract renewal. And now we
Yes.
have someone from the staff, I think it's Ms. Abram.
Yes, Children's Home Society contract, when it was originally written a year and a half ago, was written in a manner that made it look like it was a funding for $77,658. It was spread across 3 years. And we went back and looked at the board agenda, the resolution, that was supposed to have been $77,658 per year awarded for the Pine Forest High School. So me and Meredith worked together and we did an amendment to their contract. So while this contract was renewed in October, the contract is just here now because this didn't come to our attention until they went to do one of their invoices, and I had only carried forward the balance they had at the end of year one into their billing for the year two. And so when they went to do it, they're like, wait a minute, we don't have enough here for supplies. We don't have our full budget in here. So that's what started this look in the last 3 weeks. So we got this contract all redone. We added clauses in it to bring it back in line with all of our current contracts. It was one of the first contracts that we did, so it didn't have some of the same clauses that our current ones do. So that was the big changes, that it's a year to year. It gets renewed every year. And we added in some, the new clauses, like the penalty for late filing, those type things.
Okay. Do we need to vote on it? We don't need to vote on it? We don't need to vote. Can I entertain a motion to approve the amendment presented by Ms. Abrams?
So moved.
Second.
Everyone signify by the usual sign.
Aye.
Aye. So moved. The amended of the budget is approved. I think next we have Ms. Ellis. You have some information on the workshop. Can you give us an update on that?
Just to let everyone know, I've reached out to all board members, and we're going to be having the workshop on March 20th, and it looks like we're going to have full attendance. So our new executive director is going to start working on the agenda. If you all have anything you'd like to add, just shoot me an email and we'll get it added.
Okay.
Alma, do we
I
have
would
a
like-
location yet?
We're going to have it on the PSC campus.
Okay, thank you.
Is there any way, we, at the school district, for several months now, have been reviewing, some people may call it pockets of poverty, we're calling it corridors of concern, and what it actually does is it drills down to the number of students and what school they actually attend, by each, not just zip code, but by school attendance zone, and it is very focused data. It's you can drill down to math scores, reading scores. So you can imagine we're beginning to put our focus in those particular areas, and have a really smart young man that works in our IT department that has developed this. And if it would be appropriate, I would ask him to come and deliver that message along with our district data scientist. If it's not appropriate, or if it needs to be at another meeting, I just would like to ask permission to be able to do so.
No. There we go. First time with the microphone up here. No, I think that's highly appropriate. I think if we're going to make data-driven decisions, we need to have all the data that we can get. So I would love that breakdown. I'm sure the rest of the team would, as well as the board. So thank you for offering that.
And thank you. What's that date again for that workshop? March?
20th.
5:30 to 7:30 is the time?
Yes, sir.
Okay. And thank you. I think we have another recommendation from Ms. Abrams. at this
Mr.
time.
Leonard, if you would send me his contact information.
Ms. Abrams, do you have another recommendation?
Yeah, I have Resolution 2024-001 for you, which is to authorize us to add Lindsay to the bank account as a check signer, and to remove me as a check signer. So once this is signed and turned to the bank, then we'll get new signature cards ready and submitted to the signers we have.
Can we entertain a motion to add Lindsay Cannon to the bank account?
So moved.
Second.
Everyone signify by the usual sign.
Aye.
Ayes have it. It is approved. Let me see. Next, we have interim executive director.
Okay, I don't have a printed report today. I wanted to just say that I want to thank everybody for the trust you put in me for the last 6 months, and to welcome Lindsay. So I cede the mic to Lindsay now.
Well, Tammy, thank you for stepping in and handling the role very well and kept the team together. And I know that you've got a lot on your plate, both personal and professionally, and I appreciate very much the work that you put in. And so thank you.
Thank you.
I would like to echo those feelings. And I know that the two of you all have already displayed a close working relationship, and that is wonderful and benefits us as the board and benefits the organization, our providers and others. And as a team, thank you all for what you've done as we've gone through this transition. It benefits us. Thank you all.
Okay, let's move on to the next. Ms. Bush, do we have anything legal that we need to report?
I do, Mr. Chair, would like to again bring up the opportunity for us, as was mentioned, and I noted it last night as I was reviewing the Children's Home Society renewal contract of us asking our providers to have links on their websites and using our logo and that type of thing that we ask of them. But that it would be a good opportunity, I would think, for us as an organization to reciprocate with a hyperlink so that if people become more and more aware of the Children's Trust and looking at what am I getting as a taxpayer, what services am I getting, as well as someone who potentially may need some of these excellent services that were mentioned today, but they don't know how do I get in touch with them, how do I involve them, how do I make application, that it would be an opportunity for us, I would think, as well as just simply highlighting these are the various programs that we are indeed sponsoring for anybody that wants to go on there and say, what am I, how is this benefiting the community? So just point that out to our IT folks and others that know far more about this than I do.
So, Dr. Northrup, what I can tell you is that as part of my transition plan with Lindsay, a rebuild of our website is on that plan. So that is one of the things that we're looking at doing. Yeah.
Are there any more public comments? Anything from the board? If not, then this meeting is adjourned at 10:05.